Hey folks, welcome to Transplant today. Welcome to my backyard where we're going to be talking today about the TAVR procedure, aka Transcatheter Aortic Valve Replacement. Now, as many of you already realize, that's actually the procedure I'm going to be having here in just a couple of days. A procedure that hopefully is going to be a game changer for me as far as giving me more stamina, more energy, less dizziness and lightheadedness, and greater ability to breathe. And so I've been dealing with a problem with this aortic stenosis for quite a while. As a matter of fact, my donor heart came with it, so at least for the last 6 years I've dealt with it. So this may be a time in my health and my process of health that I've never experienced before. That's what I hope anyway, but nonetheless I'm going through this procedure. Now, as far as the transcatheter aortic valve replacement method versus the traditional method, to an extent, this is a lot less risky, much less invasive, and the healing time is much quicker. The recovery should be much easier, and that's why I'm looking forward to doing this. However, don't get the idea that the transcatheter method, even though it's going to be done kind of in a cath lab type situation, is without risk, okay? Basically, when they go in to bust away the old valve to get things out of the way, remove some of the plaque, the calcification, there's a possibility there of stroke, which I don't want to consider, but it's at least there. So, you know, because they're not open heart type situation, they're not as much able to control that plaque and things that break off. So it's just kind of a little bit riskier in that. But because of the quicker recovery, because of the other problems that can come along with having a full open heart, with things like infection, that sort of thing, it's a little bit less risky overall. So anyway, I'm hoping things will be without issue, things will go great. Now, with that being said, how exactly do they go about doing such? Well, it goes a lot like a traditional cath and or an angiogram that you might have just to keep up with the current heart situation that you have right now. And basically they go up through the femoral artery that is in my groin. They come up through that femoral artery, come around the aortic arch, get down into the aortic valve as it stands right now. They do that with a tracer wire to begin with, just something that shows them the path, the pattern to go through. They're all the time watching this on kind of an x-ray type method up above live so they can see where things are being placed. After they get everything in place, get everything lined up as they want, they're going to follow in that tracer wire with a balloon. Now basically the balloon is just to bring in, come down into that existing aortic valve, kind of bust it open, break away the plaque, free it up so they make room for the valve replacement. Now I'm going to be having a hybrid valve, which is basically a tissue valve. Mine's going to be a cow valve. There's mechanical cow and pig valves. I'm going to have a cow valve. It's going to be placed inside of a little stent. The size of the stent going in initially is about the center of a big ink pen, so not very wide, maybe a millimeter or two. Once it gets in there and they deploy it or open it up like an umbrella, it's going to be about the size of my index finger. That's kind of nerve-wracking within itself, but nonetheless, that's the way it's done. Now, hopefully, when they deploy the valve, they get it in exactly the right position. It opens up perfectly and it seals off, particularly on the outside edges. And that's kind of one of the drawbacks to this, because again they're not inside of you in an open heart procedure. They have a little bit less control of sealing the valve off because it's not a stitched in valve. They have a little bit less control, particularly of the plaque and potential to break off, like I said a moment ago. The stroke risk, again, don't want to say that, but they just have to be a little bit more cautious there. Now, if it places right, if it seats and seals right, from that point, it's straightforward. They open the valve up, particularly they watch it to make sure it's functioning correctly. If it is, they're going to then turn and check my heart to make sure it's pacing correctly, because the secondary risk here is the need of a pacemaker, which I don't want either, but they'll make sure that it's pacing correctly. So long as it's pacing correctly and it seals and seats correctly, the procedure's almost done. Then they just turn around, draw everything back out, let it be, monitor me for a couple of days in CICU, that's the critical cardiac care unit, and that's it. I'm ready to go home. 2 or 3 days later, 2 to 3 recovery, and that's it. So hopefully that's the way it's going to go. This is much better procedure than the full open heart procedure as far as all the recovery. Much better procedure overall with that slight risk. Okay, so I'm going to be giving you some updates in the next few days, kind of let you know how things go. Try to give you these updates as quickly as I can. We'll see. So keep me in your prayers, and keep everyone in your prayers who's going through simple procedures like this that can be somewhat scary. Okay, thank you so much for joining me today. Till next time, stay stronger, friends.